My name's Lindsey Phillips and I am a diabetes specialist podiatrist. I have been a podiatrist since 2000. I qualified in 2003. So I decided I wanted to become a podiatrist as I always knew I wanted to work in the healthcare setting. I wasn't quite sure at first what particular part I wanted to work in, but I actually came on work experience when I was 16 to Walsall Podiatry service and spent 2 weeks with the team. I absolutely loved the diversity, the patient aspect, the teamwork, and so I then went and did my A-levels and then went and qualified as a podiatrist. Every day is different. So we currently work in outpatients predominantly in Walsall Manor Hospital, and we have clinics booked every day. We have patients every half an hour. We see patients with foot ulcers, circulatory problems, infections, gangrene, high-risk diabetic foot problems. But we also get called up to the wards, inpatient wards, so we try and see those patients within 24 hours of the referral, because some of these patients who come into inpatient, they come in with their diabetic foot problem. So they may need advice with regards to forward treatment, forward planning. That might be to admit them, keep them into hospital for antibiotic therapy, or it might be discharge home on antibiotic therapy, or it might even be to transfer the patient to another hospital for further care. We work with other trusts and other hospitals, other teams. So we have many patients who are treated across hospitals, so we liaise with the other trusts regarding that particular patient and that patient's care. We liaise with all the community teams as well who are involved with that patient's care. And historically we've also carried out social media campaigns as well that have reached patients across the borough. The scope of a podiatrist in terms of their practice has changed drastically over the years, and for people who are interested going into the podiatry role, there's lots of different areas they can specialise in. I would definitely encourage people to look at AHP roles because they're so diverse. I didn't think when I qualified that I would be working on a daily basis with such an array of different people in terms of all the different specialisms, so the consultants, vascular nurses, diabetes specialist nurses, other podiatrists, physios, OTs, practice nurses, district nurses, TVNs, the list goes on, and I speak to these people on a daily basis and work with them, so it's such a diverse role, it's really interesting. When patients come in and they say that we've saved their limb, saved their foot, saved their toe, sometimes even saved their life, that really does make you go home with a smile on your face.